So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. 4 viruses are currently circulating in the United States, with some health expert calling it a quad-demic. Data from the Centers for Disease Control and Prevention show an increase in 3 respiratory viruses: COVID-19, the flu, and RSV, and the gastrointestinal disease norovirus. In fact, emergency rooms across the country are feeling the impact. So joining us today is Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And remember, folks, if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, let's start today with this quad-demic that I mentioned. Now, according to the CDC, emergency room visits are actually at the high and very high levels for flu and RSV. This is across the country. And then they're at elevated levels for COVID-19. So what does this mean? And what are we seeing here in our region?
Yeah, so we are at what may be the peak of respiratory virus season. And there are many viruses that normally circulate at this time, the most notable one being influenza. And what we have heard from many countries that had their influenza seasons before us or influenza activity before us was that this seemed to be a worse year, that there were more severe infections, more hospitalizations. And so, and that can happen. Some years are relatively mild on influenza and others are much more severe. Australia was indicating their flu season was one of the worst on record. And so this may be a very bad flu season for us. We're a little bit later getting to ours, so it's we don't know yet. But that is no doubt contributing. On top of that, we historically don't have great vaccination rates for influenza. And so we do see people get very severely ill. And then once you have influenza, you can get other complications or a superimposed bacterial infection that can be quite severe. Then we have COVID. Now, COVID, as our listeners know, is not a seasonal virus. It has many different peaks through the year, and it depends on what's happening with the variants and all. But we are in the midst of another COVID surge. So that is adding to it, as well as the fact that many people have stopped getting their immunizations for COVID, and they haven't gotten the updated shots. And so we tend to see in that group more severe disease, and those people may require hospitalization, which can contribute to the impacts on our healthcare providers. And then on top of that, we typically do see norovirus, which is sometimes called the winter vomiting disease, which is a little bit of a misnomer because it doesn't happen just in the winter, but we do tend to see a surge in the winter. We're just having a particularly bad one for norovirus that people aren't quite sure the reason. There does appear to be a new strain of it that may be contributing to it, but nevertheless, that superimposed on it. And then another respiratory viral illness that we see increase at this time of year is the RSV, which we've talked about many times on your show, which can cause particularly severe illness in the very young, particularly those under a year of age, as well as the older individuals. So we really have a confluence of viruses kind of all surging at the same time. And those aren't even the only ones. There are other ones as well.
So, Dr. Pate, with all that said, what should folks be doing right now to try and stay healthy? I mean, like, is it too late to get the flu shot here?
It is not. So I would certainly encourage people that want to help protect themselves, who haven't got the flu vaccine, to go get it right now. The same thing is true of the new updated COVID vaccine. If you hadn't previously gotten that, you can go get that, and you can get both of these vaccines at the same time. For those that are older folks like myself, if you have not gotten your RSV vaccine, you can also get that one. We do not have a vaccine for norovirus, and so that one is just going to have to be really good hand washing, and not with the hand sanitizers. I was blocking on that. Not with the hand sanitizers, but with actual soap for this one, because the hand sanitizers aren't really effective against the norovirus. So if you've got a kid or somebody in your household with vomiting and diarrhea, just wash really good with every contact to minimize the spread of that. And as with everything else, the big thing is avoid large gatherings, because right now it's estimated that if as far as COVID across the country, probably 1 in 49 people are infected. And so if you're going to be in a large gathering, there's almost certain to be somebody who's infected and can spread this. But that doesn't even take into account those that would have flu and RSV and other viruses. So avoid large groups. And of course, if you have to be in that kind of setting, of course, consider whether you want to mask to help protect yourself. And also, regardless of setting, improving ventilation and filtration of air, like in schools, hospitals, public buildings, all that can be a big benefit.
So, Dr. Pate, can we talk a little bit more about RSV for a minute? Because I'm thinking of folks who have little ones. And I'm remembering back 13 years ago when my 6-week-old got RSV, and it was scary. Now, granted, I had a 3.5-year-old that was in preschool. So, and you know, you want to keep their routine when you have a newborn. So what can you do if you're in that situation right now?
Yeah, the infants are very vulnerable to almost all of these infections. And so I think this is not the time to have infants out in public with large groups. I would try to minimize the number of people that are having contacts with your infant, because the more contacts, just the more chance that one of these people is going to spread any number of the various illnesses that we've talked about, not to mention pertussis and some other things. And so right now, during this peak of respiratory season, it's minimize their exposures. And I think that's the big thing. Now, the other thing, of course, is that's assuming that you have gotten the infant their immunizations. If you haven't, you need to talk to your pediatrician right away, because a number of these illnesses can be vaccine preventable and help protect your infant from developing severe disease and having to be in the hospital if they do get infected.
And Dr. Pate, you mentioned that norovirus is kind of atypically high this season. Is that fairly common, where something like norovirus kind of ebbs and flows maybe every few years?
Yeah, it does. And so what we can see is that you can have, we have norovirus every year, but some years it's just not that bad. Other years it does really take off, and we're certainly in one of those years. It's not clear exactly why that is, although certainly lots of suspicion that what may be going on is that new strains of the virus may be out there, and perhaps some people that might have had recent exposure and have some protection might not be protected against the new strain because there's not really long-lasting immunity against this virus. But it can vary from year to year, just as you're saying. And I think the thought is that this is likely due to a new strain that's infecting more people, but we don't really know.
And Dr. Pate, I was reading that some hospitals, and I'm talking across the United States, who are seeing these really high emergency room visits, are actually re-implementing mask mandates because of this quad-demic. Now, here's what I find interesting. This is happening at the exact same time in our legislature, in the State House, that there are some legislators who want to try and ban any type of mask mandates. And I'm just thinking about, okay, why mandate not allowing masks? Let people make a choice. Wasn't that the whole, friction 4 years ago, 5 years ago now?
Yeah, you're bringing up two important points that I feel differently about. So let me take the first one. And you mentioned about hospitals reinstituting, some hospitals reinstituting mask requirements. This is one that, as a long-time physician and hospital administrator, I just shake my head at. I have no idea why hospitals have across the country aren't doing this masking. We know that these infections are being spread in the hospitals. And so that is contributing to our problem, is that people are going into hospitals for unrelated conditions and getting infected. And so this is just, I think, shameful. And we also know that people that are hospitalized that get infected are going to have far worse outcomes, more severe disease. So I don't know why all hospitals aren't doing this. It's just something I can't even explain. Now, let me shift to the legislative bill, and particularly the one that's getting introduced in Idaho. I actually don't have strong opposition to that bill, and let me explain why. Although if you think we need to take a break, Gemma, we should probably do it before I launch into my explanation.
That's okay. You launch into it, then we'll take it.
All right.
Okay.
All right, here we go. So here's the problem. We know what has happened with people's perceptions about mandates of various forms, whether they were lockdowns, vaccine mandates, or mask mandates. And I've talked to many of these people. And of course, the recurring theme is that this is infringing on their freedoms, and they feel resentful, especially because what they hear is that these things either aren't effective or actually are harmful. Now, I believe that these kinds of mandates are not medical issues, they're policy issues. And as I told the legislator who asked me about this, I said, I don't think I should be the one or any other doctor making that decision. The legislature should, because our job is to protect everybody, and the mandates are really more of a societal issue. Now, what has happened, because people were unhappy with the mandates, instead of challenging the policy and debating that as a policy issue, they attacked the masks. So, for example, you and I heard all kinds of nonsense about people were getting carbon monoxide poisoning from masks, carbon dioxide poisoning from masks, bacterial infections, all kinds of horribles. And I had to remind people, we have used these masks in hospitals for decades. And I've never seen a provider that was wearing a mask pass out and have one of these conditions. Even in cases where we have surgeries going on more than 12 hours, that just doesn't happen. And so what happened is, instead of attacking the policy, they started making up stuff. And they started misinterpreting studies. And what it did is, instead of now just upsetting those that were feeling like their freedoms were impinged on, now it's got everybody questioning whether masks might actually hurt them or their kids, which was nonsense. What I would like to see is the legislature say, okay, look, we'll get behind your bill to prohibit these mask mandates by the government, but still allow private actors and healthcare providers to have mask requirements. We'll get behind that if you'll talk to and if you'll come to some agreement about us. Okay, what are we going to do instead? And the obvious thing that we are not doing to protect people, which I would be glad to trade for a prohibition on these mandates, is let's agree to improve ventilation and filtration of air in our schools to meet the revised new standards, because what that would do is not only decrease the transmission of SARS-CoV-2, but it would decrease the transmission of influenza and many other respiratory viruses that we've just talked about. And if you want to know, we now have the evidence that a large part of how both influenza epidemics spread and these SARS-CoV-2 infections is from school children to their homes. They bring it home. And so if we could improve the air quality in our schools, which would not be an unreasonable thing to do in light of the fact that we are subject to wildfires and smoke periodically. You'll remember last year how many times we had bad smoke days. So it would be a good idea just for that. But in fact, in addition to decreasing the transmission of these various pathogens, the studies also show students have better test performance if you have improved ventilation. And so it could be a win-win-win, because keeping kids in school should be something we should all be able to agree to. And keeping those kids from infecting their parents and then their parents being absent from work should be a good outcome. And if we were to do this, I'd gladly trade that commitment for a commitment to support the bill prohibiting the mandates. So that's my feeling.
So, Dr. Pate, the CDC is urging hospitals across the U.S. to speed up advanced testing for people who they suspect to have bird flu. Can you tell us more about this and why this is important to be doing?
Yeah, I was pleased to see this. So one of the things that I have mentioned before on the show, but people may not recall, is that both the seasonal flu, which you and I just talked about on the last segment, which is predominantly influenza A, and then bird flu, which is influenza A, they will show up on an influenza test as positive, but you can't tell which is which. And of course, we don't see a lot of bird flu in humans, though it occurs. So we're probably assuming when we get a positive flu test at this time of year while we're in flu season, that it's going to be the human flu. However, we don't know that. And then the other issue that I've mentioned before is that the influenza virus is one that is apt to go through something called reassortment. And so when we talked about SARS-CoV-2 over the last 5 years, we've talked about the recombinations and how you can be infected with two different strains and they recombine to form this new variant. Well, what influenza does is it actually swaps whole pieces of genetic material with other influenza viruses, and we end up with something called a reassortment. That is what we're worried about with an avian or bird flu virus, because bird flu viruses aren't very apt to infect humans. It's really hard because it's the wrong kind of receptor and all. However, if the bird flu virus can go through a reassortment with a human flu virus, and right now lots of people have the human flu virus, then we could see that reassortment occur. And now you have this bird flu that we've been watching and that has been a serious concern could really take off, because now it could develop the ability to spread human to human. So what we need to be doing is we need to be surveilling it. And so I think the CDC is absolutely correct. If you have somebody who is sick and gets hospitalized, instead of just saying, oh, it's influenza A, obviously you have the human seasonal flu virus, what they're saying is you need to check it further and make sure it's not a form of the bird flu, because if that's happening, if that reassortment has happened, we have to take steps very immediately to stop this from becoming the next pandemic, which we're already a little bit behind the 8 ball on.
Okay, so speaking of that, Dr. Pate, the U.S. Department of Health and Human Services has awarded Moderna almost $600 million. This is to speed up its work on an mRNA vaccine for bird flu. I have to tell you, this is beginning to sound eerily like 2020, and I'm not someone who tends to think that way, but I'm just like, oh my goodness.
Well, it should, and what this is that I'm pleased to see is learning from Operation Warp Speed. And I commend the Trump administration back in 2020 for Operation Warp Speed, which was one of the greatest scientific achievements of our time. What they did is they provided the correct incentives to pharmaceutical companies that had promising candidates for what would become the future COVID vaccines to invest in it, and to invest in it even when they didn't know whether it was going to work, so we could get it to the clinical trials and find out and do this in a much compressed bureaucratic timeline. So it was a great success. This is similar. This is saying to Moderna that here we're going to give you some of that seed money to encourage you to make the other investments to bring this vaccine to the point where we can design it, develop it, and test it, so that we could be prepared if, in fact, we see this outbreak of bird flu. And that is especially important because the way we make influenza vaccines historically is predominantly by using chicken eggs. Well, guess what kinds of birds bird flu tends to really infect? Poultry. And when it's a highly pathogenic avian influenza, which this one is that we're dealing with, it tends to kill in high numbers these poultry. So what we end up doing to control them is we cull the poultry. Well, guess what? If you do that, then you don't have many eggs. If you don't have as many eggs, prices go up, but we also don't have eggs to develop vaccine. This would greatly compress the time limit that would take if we could do the mRNA. That's the big advantage of it. We can do it in months, whereas it would take us more than a year to get sufficient bird flu vaccine using our conventional methods.
Well, as always, Dr. Pate, so appreciate all of the information on all of these health issues that we are seeing right now. And remember, folks, if you have a public health question for Dr. Pate, you can send us an email, idahomatters@boisestate.edu, and we will try our best to answer those next week. This is the Idaho Matters podcast. I'm Gemma Gaudet.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.